Hello guys, good afternoon. Today we are going to discuss about key caring techniques which we have to possess or which we have to carry when we are giving care to your patient. So before going to the class, we will discuss class rules. All students will uphold the British values, treat your class fellows with respect and dignity, think before you communicate, and welcome and value the diversity of your class. All right, guys. So now we will go to the topic. So while thinking about key caring technique, what is coming to your mind? Key caring techniques. So key caring technique is something related to caring, right? So in key caring techniques, we are following some techniques. Wherever we work or when we do some work, we have some technique in our hand. Same way to make it perfect, right? Same way in caring also, you have to follow some key caring techniques to improve the quality of care, to improve the standard of care. Okay. So this carers work have positive outcome as well as negative outcome. If you are implementing the caring technique is in an effective way, you will get positive outcome. If you are implementing the caring technique in negative way, I mean in a not an effective way, you will get negative effect. So while coming to the positive effect of carers work means, carer can take an individual out of their feelings and isolation. A good carer can help the individual to explore their problem. A good carer can help the individual or the client to exhale their problem. A good carer can help the individual to open the windows of their mind, open the windows of mind with lot of stress and struggle. That means what? Carer can reduce the stress, distress, irritations, frustrations, etc. At the same time, there are negative effects also. Carer can push the people into further isolation and distress. After listening their problems, you are just judging them. You are just ordering. You are just demanding. You are just commanding. You are not good. You are not right. You are bad. Okay. You are doing this. Why did you do that? How come it happened? Kind of question you're asking and you're confusing the patient means definitely the isolation or the distress level can increase. So carers work have positive and negative sides. So always you have to be in your boundaries, your professional boundaries, because you are not going to talk to your friend. You are not going to talk to your friend. You are going to talk to your client. There you have to maintain the professional boundaries for what? To provide quality care to your patient. All right, guys. So while going to the key caring techniques or the qualities of a good carer, there are a number of qualities, and among that, few very important thing we are going to discuss. Among that, the first and foremost thing is respect. You have to be respectful, or you must show respect towards your patient. If you're not showing respect towards your patient, definitely your caring process will not work in a proper way. Understand their problems and respect, irrespective of the age. Okay, that is an older person, you have to respect. Nothing like that. Irrespective of the age, you have to respect your client. When you start respecting your client, automatically the client will start respecting you. Automatically, a give and take policy will take place, and the standard of the care will increase. Next thing is patience. So when you give care to your patient, you have to show some patience. Okay, PATIENT, patient, client, service user. So when you give care to your patient, you have to show some patience, PATIENC. If you show some patience towards your patient, definitely the care will be effective. So when we start listening, show some patience. Don't show frustrated face in front of your patients. Don't show your irritability in front of your patient. Don't show any aggressive talk in front of your patient. If you do, it means that you don't have patience. If you don't have patience, you cannot take care of your patient. So guys, that is one of the other important key caring technique you have to keep in your mind while giving your patient, because you have problem, the patient is having problem. You are also a human being, the patient also a human being. So while giving care, you have to show that patience. You have to keep that patience in your mind before going to enter into the room of patient, before going to start some therapy, or before going to do some procedure. Then only you can provide effective care to your patient. Then next thing is empathy. You have to be empathetic. You should show empathy towards your patient. Hope you know the difference between empathy and sympathy. Empathy and sympathy are entirely different. Sympathy means after seeing a situation, I'm telling like, oh, so sorry, everything will be all right, nothing to worry. If I'm telling that means that is known as sympathy. Empathy means if I'm getting into the shoes of that patient and working for that patient means that is known as empathy. So when you work with the patient, you have to show empathy, not sympathy. Sympathy you can show to your friend, to a family member, to your colleague. Okay, but empathy you have to show to your patient because challenging people are there, older people are there, disabled people are there. So sometimes they cannot express their problem in a proper way, so you have to be empathetic. Sometimes they cannot explain, like they need food, so just get into the source of that particular patient and understand that they need food. And when we give something like some kind of therapy, sometimes they cannot explain it is effective or not. Understand the situation. If you are in that situation, how you will behave. So empathy is very, very important. Understand the emotions of the patient. Guys, you are not going to deal with a machine. You are going to deal with a human being with blood, flesh, inhaling, exhaling, breathing, same like you. Another specimen is standing in front of you. Don't forget that you have to be empathetic. When you show empathy, automatically you can improve the standard of your care. You can improve the quality of life. Then next thing is reliability. Hope you know the meaning of reliability. Trust. Reliability. You have to responsible. You have to be reliable for the work, whatever you are doing in a care home or in a hospital, wherever you're working. For example, if you're responsible for documentation, while documenting, don't do copy and paste and stuff like previous days thing, just turn and copy and paste. Because the previous day is entirely different from present day. Previous days, patients, emotions, feelings, appetite, weight, height, sleep pattern, pain scale is different from today's situation. So don't copy and paste anything. So you have to be responsible for the work, what you're doing. When you are if you are responsible for giving food to a particular patient who have this disability, definitely you have to be responsible. You have to make sure that the patient is okay, the patient is happy after having the food. Just so show that reliability whenever wherever you are working. So that is very, very important. You have to ensure that the work has done in a proper way. So that is another key caring technique which you have to possess while giving care to your patient. The next thing is encouraging. Encouraging is a common thing. So encouraging, you have to encourage yourself, at the same time you have to encourage your patient. In this scenario, I mean, in this situation, you are encouraging me to sit here. At the same time, I am encouraging you to work and learn and study. So there is a mutual encouragement and encouraging is taking place between you and me. Same way, when you work in a hospital, when you work in a care home, when you work in a teaching, I mean, special education needs center, when you're working in a counseling or therapy center, you have to show this encouraging mentality towards your patient. Then only you can improve and you can improve the standard of your care. So you can improve, you can create a reinforcement, positive behavior, positive environment between you and your patient if you encourage your patient. If you're not encouraging, if you're showing a sad face like this, and if you are telling, if you want to tell, if you tell, otherwise no need of telling. Like that, if you behave with your patient, means how they will feel to explain their problem, how they will feel to what open up their problems. So encourage them. So if you're sitting, you have to be reliable. If you're sitting, or you have to be reliable, you are responsible for the work. You have to sit for that particular 10 or 20 minutes. You have to encourage your patient and collect the information, write it, record it, and improve the quality of your care. Then showing approval. That is very, very important, guys. You don't feel much while listening thank you or well done in a regular conversation or regular day-to-day activities in between friends. Thank you. So when we sit in a hospital or when we are lying on bed and as a bedridden patient, thank you, well done, matters a lot. That matters a lot because nobody is there to take care of them, nobody is there to look after them. In that case, you are going and you are giving some approval for them, means imagine they feel very happy. That can improve the quality of care, that can improve the standard of care, that can improve the condition of the patient. So showing approval. So if you see something, like if they're doing something, if they are responding back to the medication, if they are reacting back to the treatment, well then you are doing it, you're doing awesome, you did it, you can do it, never give up. If you say this kind of approval words, means definitely you can improve the standard of care. Then trust. Guys, create trust. Always try to create trust. How you can create trust? You have to maintain confidentiality and privacy in your conversation, then automatically trust will develop. If your client is saying something very confidential, very secret, and very private thing to you, means don't share with your colleague or don't share with your friend while doing a common discussion or while having dinner on dining table. That's not the thing to discuss or disclose in front of everyone. You have to disclose that only to your designated or designating lead. All right, guys. So if you keep that point in your mind, definitely you can create trust between you and your patient. And eventually, there is an open communication channel you can develop between you and your patient. And gradually, the quality of care and standard of care you can improve. So this is a case study. In this case study, there's a discussion. Okay. So if you read this case study, you will understand one of the client, he explained or she explained his problem to the carer. And the carer went and told these things to carer's friend. And that friend came and asked about the same thing to that individual. Then how that individual feel. Imagine, I am telling something to you. Okay. And I'm telling that don't tell to anyone, and you are going and telling to your friend, and that friend is coming and asking, oh, is it all, is that right, is that all right, okay, is that truth, is that happened to you? Oh, I'm so sorry. Like that friend is telling to me means how I'll feel. What will happen? The confidentiality will get breached like anything. Okay, the confidentiality will break. So we can say confidentiality breaching will happen in that stage. So in that case, there are a lot of problems will develop. So if I ask a question like, what are the implications of this for the care relationship? Means the relationship will get break. Then has the care breached the confidentiality? Yes, of course, because that's a confidential thing, right? So what is happening there means immediately knows that confidentiality has breached like that. The client will come to know that care confidentiality has breached. So they cannot maintain a good relationship with the carer again. And that will negatively affect the quality of care. And apart from that, add some of the key caring techniques which you have to possess while giving care are gaining complaints. Care workers have no authority to order, coerce, or threaten an individual. You don't have the right to order, you don't have the right to threaten, or you don't have the right to demand. Instead of that, you can give suggestion. I think this would be good for you. I think that would be good for you. I feel, instead of saying this is good, that is not right, this is not right. You don't have the right to say. All right. If you maintain a balance between these things by understanding the professional one, personal boundaries means definitely you can improve the quality of care. The next thing is social perception. A care worker should always be able to recognize accurately individuals' feelings, needs, and intentions. Intentions are often shown by facial expressions, posture, and tone of voice. Carer also use eye contact to communicate effectively, but in some cultures, making eye contact is thought to be offensive. For example, like Japan and all. Okay, so social perception. So you should understand the social things, rules, norms, rituals, which is there, which is around you, which is there in your surrounding. While dealing with that's what I'm telling. While dealing with the patient or before going to deal with your patient, you have to do a proper history collection and you have to understand the condition and you have to understand the personal history of the patient. So after reading the personal history collection and history collection report, if you're going to meet the patient, is definitely you can respect the social perceptions of the patient. All right. So sometimes we will use non-verbal communication like no, yes, no, no, yes, hello. So in some community and some culture, that is fine. In some culture and community, that is not. That will consider as some offensive thing. So understand that before going to communicate your patient, because whatever you're communicating, whatever you're discussing, all are sensitive in some aspects. So you have to be very careful and you have to have a social perception. You need a proper understanding about the social perception of the patient before going to talk, and don't use anything which hurt the patient. Then disengagement. In the action of or process of withdrawing from involvement in an activity or situation or group, for example, care worker should give a reason for withdrawing from the activity and calmly walk away if they are in a hostile situation. So you are giving some care, or you are indulging in any kind of activities with your patient means you have to complete it. That's what I said. You have to be reliable. If you cannot continue, have some problem, you have to discontinue. It means please communicate with them and hand over the work to someone. And that's what again I'm saying. You have to be reliable. You have to be responsible for the work what you're doing. Then automatically you can improve the quality of your care. Then distraction, physical conduct, modeling, working alongside is are some of other key caring which you have to keep in your mind while giving care to your patient. Distraction. Care workers can teach individuals to develop distraction techniques while dealing with discomfort. This is completely focusing on mental health. If some situations are triggering a patient to get into a violent stage or to move into a violent stage means the care worker or support worker can distract them by indulging them or engaging them in different kinds of activities to alleviate their discomfort and anxiety and pain. So these kind of things you have to do based on the registered nurse or registered doctors or registered psychiatrist guidance until unless you get registration in the particular field. Then physical contact. Physical contact, you have to be very careful about physical contact. So sometimes maybe you're showing caring and you may hug, you may hold their hand. But if they don't like it, you have to be very careful because in different culture, different religion, different custom, different class, different kinds of rituals and rules they have. So conducting or while touching, ask permission. Okay, so sometimes it is against their rules, norms, and rituals, touching and talking. Okay, so you have to ask the permission. Can I do that? Are you okay with that? Okay, are you comfortable? You have to ask. Then you can improve the quality of your care. Then modeling. Carers use modeling by showing socially acceptable behavior in a situation in the hope that individual will learn to act in similar way. Okay, so modeling in the sense like say thank you, yes, please, kind of things you can say always. So if gradually the patient will start to respond back, thank you, please, okay, okay. Otherwise, you can give some, you can act as a model. As a carer, you can act as a model before you enter into the room of the patient. Hello, are you there? Can I come inside? Or before going to give a cup of coffee, would you like to would you like to drink a cup of coffee? Would you like to have some biscuits? So if you start acting like a model in front of the client or in front of the patient, gradually they will adapt the things and gradually they will respect back, they will react back, they will respond back in an acceptable way. So that is another key caring technique which you can implement to improve the quality of care. Then working alongside. You are a part of MDT, multidisciplinary team. So work together, work with everyone, work with the patient, work with the team, work as a team and improve the quality of care. So these are all some what key caring techniques which you can use to improve the standard of your care. Then setting challenges. So sometimes for some activity, some clients or patients will face challenges like doing some physical activities. If they are not able to do the physical activity means you have to what you have to find out the necessary remedies to overcome that particular situation. If they're bedridden, what kind of activities we can give for them? If they can move only hand not leg, what kind of activities we can give to them? So always keep the challenges in your mind and work towards that. Then you can improve the quality of care. Then safe work practice, that's very important. Health and safety is a part of everything. Okay, right? The health and safety, without following the health and safety procedure, if you work, definitely that will affect you in a negative way. So you have to follow the norms, principles, procedures of your institution, hospital, or care home. Then you start working and follow the guidelines, understand the guidelines of the health and safety. And if you have any doubts or problem, go and talk to your designating safeguarding lead and clarify your doubts and go ahead. Then And if you are feeling something uncomfortable, if you see something unusual, if you see something on the body of patient and in their conversation something unusual, please do communicate. So open communication is very, very important in terms of safe working practices. And apart from that, observation. You have to observe your patient in a proper way. So if you are medical observation or visual observation, whatever the observation, if you are a part of measurements, if you are a part of health measurements, or if you are part of checking, if you are part of diagnosing, if you are part of records and reports, if you are part of documentation, do the observation in the best possible way to provide effective care to your patient. So when it comes to medical observation include checking blood, checking body mass index, checking the pulse rate, checking the blood pressure rate, checking the body fluid, sample collection, height checking, weight checking. Whatever medical observation you are doing, or you are supposed to do, or you are allowed to do in an exact way. Don't write something. If your head is not there, means okay, simply writing something and something. Many people are doing like that, so don't do that. Okay, do in proper way and submit it. That will definitely improve the quality of care. Then visual observation, like if you observe like whether the patient is having food or taking or not taking, drinking or not drinking, behaving in a good way, mood change or manic or depressive or aggressive, whatever you're observing, that you have to write in a proper way. You have to escalate the issues to your head if they are showing some unusual behavior and all those things. If you follow these things in your daily day-to-day caring process, definitely you can provide 100% quality care to your patient. So this is about the key caring techniques which you have to possess in your hand. This is just a few numbers. There are n number of key caring techniques, and depend upon the hospital, depend upon the institution, depend upon the college and schools, there will be some variation, but the basic principle always remain unaltered, guys. So you have to show respect, you have to show empathy, you have to show approval, you have to show encouragement, you have to show patience, you have to be a good listener, you have to give some space to talk, you have to observe everything in a proper way, you have to record, you have to be reliable. Okay, so if you keep these points in your mind, definitely you can improve the quality of your care. So these are all the key caring techniques which have to possess while giving care to the patients. Hope you understand, guys. Thank you. We will see in next class with other topic. Thank you for listening.